Yes, welcome. So that we can have a short discussion, so that we can break, we can tackle anatomy of the heart, and we are going to review what we call the cardiovascular system. It contains some what we refer as the components, which includes the heart, blood, vessels, and the blood itself. But today I want us to focus on the heart, so that we can check on the structure and the blood flow of the heart. So that's what I want us to go through now, so that we can see, we can review and understand it. So what we need to know is that the heart is usually, it has the right side and also the left side. So on the left side, we have what we call the atrium, and also we have the ventricles. The ventricle. Still on the right, we have the atrium, and also we have the ventricles. So now we can start by drawing, so that we can now see and be able to know where the left atrium is and the ventricle where it is. So it's not a perfect diagram, but it will assist us to be able to learn about the various structures that we have. So as we always know, the ventricle, the left side of the heart is usually a bit thick, so this is our heart will look like. So you'll find that now on this side, on the left side, we have this valve, which we call now the bicuspid valve. Why we call it bi? This is because it's made up of two cuspid, which are facing on the downward, so that it can be able to allow only one way, the blood, so it always allows blood to flow in one direction, only one direction. It can only allow blood to flow from the atrium to the ventricles. Then on this other side, on the same side next to it, we have another valve, which is facing upward, and this is a continuation of the cardiac septum. So now this is where this is what we call now this valve. We call it aortic semilunar valve. And the reason as to why we call it the semilunar valve, this is because it's similar, its shape is similar to that of the moon, which we call the luna. So this is what now we call, this is an extension of the aorta. So what you need to know, the difference between these blood vessels, that's the artery and the vein, is that the vein usually carry blood to the heart, and the artery carries blood away from the heart. So don't forget that. So then after that, we can proceed on drawing our ventricle. It's a bit. So now this is our left auricle or atrium. So, but as we know, the auricles must contain an opening where the blood flows from. So we have 4 of them. So the first flow, this is where the blood will come into. And the reason as to why I have used the red one, because it's usually oxygenated blood. So this blood will get to the heart, also through to the left ventricle, through pulmonary vein. These are the pulmonary veins carries oxygenated blood, which is from the 2 lungs that we have. So you'll note that now on this we are going to also have another just to represent the pulmonary vein. We're going to just have to, but remember in every part of the lung we get to, we usually get to pulmonary vein, which carries oxygenated blood now to the, which comes to the left atrium or the auricle. Now we are going to proceed on this other side, which is our right side, where we also have this valve, which we call the tricuspid. We call it the tricuspid. This is because it has two cuspid facing downward, and also we have a third one on the lower part of it. Then that's why we call it the tricuspid. Then next to it, we have now another valve facing upward. Yes, which allows now blood to flow towards this direction, and this is what now this is what we call the pulmonary artery. So for the purposes of the pulmonary artery, it usually carry. Remember, as we are going through this diagram, is that we need to understand that it allows blood, once the blood gets into the right atrium and flows to the right ventricle, it will not be pumped out of the heart through the pulmonary artery, which we're going to understand where does this blood go to. Then we also have this part of which we are calling now. This is the right atrium. So what you need to know is that the muscle between these muscles, if you compare the right atrium and the left atrium, is that also the left atrium muscle is a bit deep compared to that of the right side. And that now this is our right atrium. But as we know, blood flows to the heart through what we call the vena cava. But when it comes to the vena cava, we have the superior and also we have the inferior. So this is our superior vena cava, and this is our inferior vena cava. Now we have just gone through the structures. Now I want us to discuss the blood flow so that we can be able to understand it. But now the other thing that we need to also remind ourselves is that the heart is usually made up of 3 layers of muscles. The one that I'm shading to be red, that's the medium cardiac muscle. Which we call the myocardium muscles. The innermost is what we call the endocardium muscle. Endo means inside. Then on the outside of the heart, what I've just shaded is what we call the pericardium muscle. So for the pericardium, peri means perimeter, so it means it covers the heart and also protect the heart and prevent the heart from over exaggeration of expanding when the heart is contracting and relaxing. This is what to prevent the heart from over expanding. Now we need to understand how the blood flows so that we can be able to understand. That was part of the structure. Now we need to understand how the blood flows. So I'm going to use the blue pen on this. So the blood is, we are saying that it gets to the heart through the vena cava, then this is the inferior. So we are going to have this blood from the inferior vena cava flowing to the right atrium. But where is this blood coming? It's coming from the lower body parts. The examples of the lower limbs, and also the abdomen, and also the inguinal areas. Then we also have the superior vena cava. Superior vena cava brings blood from the upper part, upper body, which we can give an example of the head and the neck. So this blood will also flow and get into the right atrium. So when the blood gets into the right atrium, it will be held together in the right atrium. But remember, we have the tricuspid valve, which will hold the blood together so that it can remain into the right atrium. But the moment where we have the contraction of if we have the depolarization of the right atrium, we'll force this blood to move downwards forcing the valve to open. Because it's a one-way valve, it's going, once the blood accumulation of blood within the heart is the maximum level that's in the right atrium, it is going to allow no blood to flow to the right ventricle. So once the blood flows into the right ventricle, is that the ventricle will contract. But remember now, because this valve usually it's a one-way valve. The immediately we have pressure on the lower part of the ventricle moving to upwards, it's going to force this valve to close, and this force will also cause the pulmonic, here we have this valve, we call it the pulmonary semilunar valve to open. It's going to cause the semilunar valve to open. Once it opens, it forces all this blood to upwards to the pulmonary artery. So remember, what happens about this heart during contraction? It forces these, the lower part, which we call the apex of the heart, it moves upward, it will contract together with the septum, and it's kind of like you're squeezing clothes. So it forces all this blood to move out, to escape through this valve, which are calling the pulmonary semilunar valve. Once it gets now past the semilunar valve, it cannot get back because this is also a one-way valve. So blood will be held and will be forced now to flow to the pulmonary artery. Once the blood flows to the pulmonary artery, it will be forced to the right and the left lung for oxygenation. So once the blood becomes oxygenated, it's going to come back through the pulmonary vein. It's going to come back to the heart through the pulmonary vein. Once it comes to the heart through the pulmonary vein, it shall be held at the left atrium. Once it is held at the left atrium, once the atrium contracts, it's going to allow now this valve to open and allow blood to flow into the left ventricle. But something I need you to note is that when it comes now to electrical conductivity of the heart, where we have all these valves, we have a fiber which does not allow conductivity of the heart, and that's why these valves do not open when we have the electrical conductivity. So, which we are going to cover later, but for now I want us to understand these. Then after that, once the blood comes into the left ventricle, it is going to be, once the left ventricle contract, it's going to force this blood to move out of the heart through the aorta. So here we have what we call it's a one-way valve, which we are calling aortic semilunar valve, which is going now to allow blood to flow to the aorta. Then from the aorta, we are going to have a branch, many branches, so that we can be able now to have this oxygenated blood circulating to the whole body. Remember also this organ, which we are calling the heart, also requires oxygenated blood for it to be able to function. So the blood from the aorta is going to go to our lower part of the body, as well as the upper part of the body. Now I want us to just do a quick summary of these so that we can end our session today. So we are going to start with the flow of blood from the body. So what I need us to do is just a summary. So the first thing that we know, from the body we have the deoxygenated, blood. So this deoxygenated blood will flow to the heart through two veins, which we are calling the superior and the inferior vena cava. Then the superior vena cava carries blood from the upper part of the body, which is the head and also the neck. Then we have the inferior vena cava, which carries blood from the lower part of the body, example, the lower limb, the abdomen, and also the inguinal area. Once this blood gets to the vena cava, it flows to the heart, to the right atrium. So this blood is held together at the right atrium by what we call the tricuspid valve, which you have said the tricuspid have three cuspid, and that's why we are calling it three cuspid. But something else that you need to note about this valve, they usually also held together by what we call the tendons. They are held together by tendons, so that they do not overstretch. Once the blood is in the heart right atrium, what you're going to find is that once we have an depolarization in the atrium, is that blood will flow to the right ventricle. The blood will flow to the right ventricle through the tricuspid valve. Then, once the depolarization happens again of the ventricle, is that now the tricuspid valve, they are going to close, so the tricuspid will close. Remember here, it's opened to allow blood to flow to the ventricle. But here it's going to close, and it is going to force the blood volume and the pressure will force now the pulmonic semilunar valve to open. Once it opens, it's going to allow blood now to flow all the way now to the pulmonary artery. The blood will flow to the pulmonary artery. Once the blood flows to the pulmonary artery, now it will be forced due to the pressure of the heart, the right ventricle. It's going to force this blood to flow to the lungs. But there's something that you need to note. The pressure on this side, on the right side, is a bit minimal compared to the left side. This is because the lungs do not require blood which has high pressure, so that it doesn't cause any damage of the lungs. So you'll find that this pulmonary artery is going to divide into four, and two pulmonary branches of the pulmonary artery, they are going to get into the right lung, and the two will get to the left lung. So what will happen in the lungs, we're going to have oxygenation process of the blood. Once the oxygenated blood now gets it's oxygenated in the lung, it's going to flow back to the heart using the pulmonary vein. So when the blood gets to the pulmonary vein from both two lungs, we're going to have now the blood will be held together at the left atrium by the bicuspid And remember, by the bicuspid, we said that it has two cuspid which holds it together. Then after that, we're going to have now this bicuspid. When depolarization happens, it allows the blood to flow to the left ventricle. And remember now, the left ventricle has a very thick muscle. So what will happen is that this thick muscle will force the bicuspid valves to close because it's a one-way. Then it will force the aortic semilunar valve. It's going now to force the aortic semilunar valve to open, so that now the blood can flow to the aorta. And once the blood flows now to the aorta, once the blood flows to the aorta, now we get this blood flowing to all the body organs that we have in the body. And that's the flow of the blood and also the structure of the blood. And my name is Anthony, and we are going to review more of this. So watch out for the next video, where we are going to learn about now the electrical conductivity of the heart, so that you have heard that I've mentioned about the depolarization and repolarization. So we are going to cover that in our next class. Having no other question, I wish to end our discussion from there, so that we can meet next time and be able to review now the electrical conductivity of the heart. So you can be able to watch much of these videos in what I have a channel that I refer to, the unheard stories from the nurses. I want it to be part of where we can teach and also discuss the challenges that we face as nurses when it comes now to the kind of environment of where we work and how we are treated by the patient and also the other healthcare providers, so that we can be able to take care of ourselves. So thank you so much for watching. May you subscribe and also like our videos, so that we can be able to have more, we can have just as a way of motivation, so that we can be able to keep on producing and be able to enlighten you with more stories and education. Thank you so much for watching.